When it comes to coronavirus in children, there's so much that we are really learning. Coronavirus in general has been so puzzling for me as a pediatrician, just because it has not acted like other respiratory viruses. We know illnesses like influenza and respiratory syncytial virus, RSV, tend to just wreak havoc in children. And really with coronavirus, we're just not seeing that similar thing play out in the pediatric population. That always makes me excited as a pediatrician that this is not a virus that is making children severely ill. And really the numbers of cases in children are certainly much lower than we're seeing in the adult population. We're continuing to learn so much about this virus on a day-to-day basis sometimes, but when we look at the data we've been able to collect thus far from our pediatric population here in the United States, it seems that children have really only accounted for about 2% of hospitalizations from COVID and 0.07% of the deaths from COVID. So again, it's just a virus that acts much different than the other respiratory illnesses that we're so used to seeing in children. When it comes to children and coronavirus, we know that children, especially those 10 and under, are typically getting coronavirus from an adult or a positive adult contact that has coronavirus. This is important, especially when it comes to discussions about our children in school and daycare settings. Coronavirus has certainly impacted everyone across this country, and our children are no different. Again, because we don't see coronavirus causing as much significant illness in children, really the effects of coronavirus have been more on the psychological and mental health of children. Beginning in March, our school-age children suddenly no longer could attend school. They were not in settings where they had those social interactions with other children. They had big educational gaps and losses because of that loss of education. We know that our teachers certainly jumped right in and did the best that they could to establish that virtual learning in March, but the loss of educational milestones was just so huge for so many children. And as this pandemic has continued to play out between lockdowns and quarantine, we know that children have certainly had more anxiety. I've certainly seen more depression in children. And all of these things, I think, are really the effects that coronavirus has had on our children thus far. When children have huge change in their behaviors, they're not wanting to be away from a parent, or for my older kids and teens especially, depression has been huge. So children just only wanting to stay in their room, not doing the activities that they once used to love, not wanting to engage and interact with family or friends. Those are all really big red flags for me that something is just not quite right. Really more for a child's mental health. And those are really important things to watch for right now. Again, just as COVID's big effect in children, I feel strongly is going to be more on their mental health than the physical effects of it. It is clear that coronavirus is going to be with us for the foreseeable future. And with that in mind, it's very important that we try to get our children back to their normal routines. And most importantly, this is going to be in-person learning in the school setting. Now, there are going to be some children who virtual learning is going to be important. For example, children who have underlying medical problems, they're immunocompromised, or perhaps even they have family in the household who have these underlying medical conditions. A virtual option is going to still be very important in those situations. But for the vast majority of other children, our goal really needs to be getting our kids back into the school with very important mitigation strategies in place, not only for the health of our children, but for the health of our teachers as well. But we've got to get our kids back to learning in the classroom so that we can overcome those educational gaps that began after the onset of the pandemic, and also to allow them those key critical social interactions that they need for their mental health and well-being. When it comes to ways that we're going to be able to keep our kids healthy, again, some of those mitigation strategies that we discussed previously for school learning, important things are going to be masking. I think we're now to a point where everybody has gotten used to wearing a mask, and we still certainly recommend that everybody 2 years of age and older wears a mask. I still have parents that say all the time, there's no way my 2-year-old will wear a mask. But I will tell you, kids will surprise you on a daily basis, and if you set the expectation for wearing a mask, children will rise to that occasion. I have had 2-year-olds who wear their mask far better than an adult will. So set that expectation. I encourage parents to model that behavior of mask wearing, and your kids will follow that. Also, we want to remember that social distancing. So, in school systems, in the school setting, we try to keep them, spaced out in classrooms when possible. We want to limit these large parties or get-togethers that are going to be indoors. Try to keep things outside, and certainly, keep that social distancing when possible. Also, we want to make sure to continue to encourage our children to hand wash. I find that actually children are better hand washers than adults sometimes too. But make sure hand washing, particularly before they're going to eat, if they've been touching any other objects that other kids might have been touching, but really good hand washing. And then finally, I encourage parents, make sure to keep your children's immunizations up to date. As we head into the winter time, flu vaccine is going to be critical to keeping children healthy as well. But just all their regular routine vaccines, it's very important that we continue to maintain our vaccination rates even through this time with the pandemic.